Hey everybody, in this video we're going to look at some basics of musculoskeletal and osteoporotic assessment. Depending on your medical career and trajectory, you may or may not be doing some of these assessments, but I just want you to be aware of when we look at this system, what are some of the things that we're trying to evaluate from a medical perspective. So some considerations medically for the musculoskeletal system. And some of this will get into muscle conversations that will be happening next week or the week after. But things like inspecting for posture, movement, and general body symmetry. We're looking for things that suggest irregularities, like one shoulder is lower than the other, or they have some rotation, their hips are not quite aligned, or they have some swelling or tenderness in different parts of the body that suggest skeletal concerns. Again, these are all things that we're looking for general assessment, just as a predictor of potential issues down the road. Inspecting and palpating the spine for contour and tenderness. Once again, looking for changes that might indicate potential problems with bulging discs or vertebral damage over time. Inspecting the limbs for skin changes and symmetry. More on the integumentary side, but once again, looking at limbs in terms of are they symmetric? Do they have, and it kind of goes to the next one, do they have the range of motion that we would expect? And we'll talk about motion and joints more in the next unit. Looking at muscle mass, tone, and strength of limbs. Crepitus. Crepitus is their painful bone grinding on bone, and we'll talk about that more in joints as well. And even assessing the gait. When you have somebody walk, and you're looking at the speed and symmetry. Is their step from right to left? If the right foot goes forward, is that bigger than when the left foot goes forward? Looking at their heel to toe, their heel strike and toe off. That is, how does it line up? How does their gait line up when you're looking at it? And antalgia is, are they favoring a leg? Are they stepping and then stepping off a leg real quick because it hurts? So these are things that, again, we're paying attention to as musculoskeletal considerations when you're doing basic assessment. What about osteoporosis? What are some of the things that we're looking at for here? How do we potentially predict that someone is going to have osteoporosis? There are a number of good tools out there now that give you some early, your own self-assessment of osteoporosis risk. This is one that is found and copied for you here, and here's the website in case you wanted to do it yourself. It takes about a minute to do it. I did it. I'm low risk, thank you. But it asks questions about alcohol consumption, cigarette consumption, your physical activity level, obviously your gender, obviously your age, looking at things that are potential risk factors. So one of the ways that we really pay attention to osteoporosis risk is many times you don't know you have it until you have that first fracture, unless you're being screened for it. So one way of even looking at which people should be screened more aggressively is doing these risk assessments. So as you will learn in the medical field, one of the most important tests you do, the most important things you do, is talk with patients and get their history, get their story. And you may find that someone who has a genetic background of many people in their family have had osteoporosis, and they meet multiple risk factors, should be moved into a risk assessment group that's different than somebody who doesn't have those risk factors. So again, sometimes this is going to be asking the right questions. But there are medical tests too, or medical procedures that give us a better sense of someone's osteoporosis risk. If someone has a history of osteoporosis, clearly, or if they have fractures, fractures are predictive of osteoporosis risk. You'll be reading about a study that looks at wrist fractures and how that can be predictive of certain kinds of fractures in the future. So again, that family medical history, as well as a history of fractures itself, is a predictive factor for osteoporosis. There are some metabolic tests, particularly with blood and urine, that look at the metabolism of bone. Specifically, we're looking at calcium in the blood. We're looking at some hormone levels in the blood that give us some sense of, is somebody potentially putting a lot of calcium into their blood and therefore potentially weakening their bones. So there are some blood and urine tests that give us some bit of osteoporosis assessment. One of the better procedures is called a DEXA scan. Essentially, it's a fairly complex X-ray system that actually looks at bone mineral density. And you can see a little bit of the chart here, how it's not just the, you can see the bones, but actually you can see the colors here indicate some density. And here, the gray or the black indicates low density or very small density. So you can use that to develop a profile of risk. And I'll show you how this chart works here in a second. And let me get out of the way. So you can see that you end up with these measures of, here is the neck, here is select the tooth. You can look at different areas to get some estimate of how is their overall bone density. Bone density is directly related to, of course, osteoporosis risk. You see also you can come up with a calculation called a T-score. A T-score is actually used to compare someone's test results versus a national mean or an international mean. And if someone is below 2.5 standard deviations below the average young adult, then they are considered to have osteoporosis even if they've not had a fracture. I'll just show you the chart here just for a second. Please don't try to memorize this. But you see, if someone has a normal bone density, then they're within plus or minus 1 of the standard deviation. Basically, their average is pretty close one way or the other to most other people, which tells us that historically people in that range have no osteoporosis risk. But the lower you go, you see here, if we are below 2.5, below the standard, below the average, then we say that someone has osteoporosis. And then the severe or established osteoporosis is even when they're lower than that. So those people then are at high risk for osteoporosis complications, including fractures. One other way of assessing that's brand new that you've probably not heard about yet, but would be very interesting to see in the future, is there are some British researchers who have done a lot of work with looking at scans, dental scans, when people have their, usually every 2 years or every 3 years, they will have the complete orofacial scan to look for any kind of cavities and issues. Well, you can also look very carefully at the mandible itself, and you can look at areas of thickness and areas of where the bone is not dense. And they've been able to use some programs to predict, based upon mandibular x-rays, someone's osteoporosis risk. So it could be a standard practice, since most people have these kinds of scans done every 2 to 3 years, that your dentist in the future will be able to also not only find your cavities, but also tell you about your osteoporosis risk at the same time. So this is a new technology, still not widely available, but it might be one that is taking advantage of the fact that people have these x-rays. We can also screen them. So even when someone's 40, when they're not in a high risk group, we can have baseline measures of their bone health going back to their 40s or even younger. So some cool technologies. Again, what we're focusing on here is just how do we know someone might have osteoporosis, and what are some things that we want to assess in the musculoskeletal system. So that does it for this video. Thank you very much.